Hannah, it's great to see you again. I'm happy you could come back in so we could go over those exam findings with you.
Thank you, me too. I'm excited.
Well, I just wanted to let you know that I have some good news. You've done the right thing by coming to see us. I've gone over your exam as well as those x-rays that we took the other day. And I'm confident that what you have going on currently right now is treatable with chiropractic care. So you're in the right place at the right time. All right, so like I said before, what you have is a chiropractic problem. So I wanted to go over a few facts with you, especially because you haven't had that chiropractic care before.
Right.
So, like we had you watch the video the other day, and it talked about how chiropractic care is not new, it's not experimental, and it's been treating conditions like yours successfully for about 100 years now. In fact, it's been so successful and popular, it's actually become the second largest healing profession in the Western world. An important fact, WebMD actually did a study recently where it took about 2 million participants over 4 years and found that our patients have a 95% satisfaction rate, which is awesome, don't you think?
I do. That's amazing.
So you should feel confident that you've come to the right place for your care. Another important thing is that chiropractic care is also natural. And I know we're in a very drug-heavy world right now, but your body actually has this amazing ability to heal itself, which is actually superior to anything that a man can create, like those drugs. And I want you to think about it with its ability to heal itself. Think about if you cut your finger. You don't have to tell your finger that it needs to heal itself. Your body does it on its own. In fact, the next time you probably look down at your finger, you probably can't see where that cut was before. And what does this is our central nervous system, because it sends messages to the rest of our body and it's able to diagnose and heal itself. And so first, we want that more natural approach to care over those drugs, which at times can have those nasty side effects and sometimes even cause addiction. Which, not to say that drugs don't have their place, but they should be our last option, not our first. Now you're probably wondering, why do you feel this way? And
I am.
so what actually is causing a lot of your pain is the accumulations of events over your lifetime. In fact, it didn't start yesterday. Because even though you're having pain today, pain is actually one of the last symptoms to show up, which is kind of interesting to think about. And because of that, those events that I was talking about could even have started as early as when you were born. Have you ever seen a baby be born?
I have not.
Well, if you do get that chance, you'll probably see that there's a lot of straps that goes on the head, the neck, and the rest of the spine. So you probably need care even starting then. And then when we get older, when we're kids, even become teenagers, we have those slips, those falls. There's a lot of hits and physical trauma that take place in our body. And it's amazing how we live past 5 years old with all of that trauma. The point I'm trying to make is that we needed care, even since birth, to help with that wear and tear and some of those problems you're having today. So I want you to keep in mind that if you do have kids or have future kids that you're thinking about, they might live to be about 100 years old. And so you want them to have that good mobility the rest of their life. Now, another thing I want you to consider is, like I was telling you, those accumulation of events. So we don't always lift things properly. As you can see these people in this picture, we don't always lift properly every single time. Just like sometimes when we're at our desk, we have that poor posture and we have those other events that add up. So even for you, I know that you felt that it was you reaching under your bed to try to grab that object you were looking for that sparked that pain. When in reality, it was the accumulations of events over your life that allowed for that one wrong move to allow for that cascade of pain.
Oh.
So I want you to think about it like the dentist. So say for instance, you never went to the dentist or brushed your teeth since birth. How do you think your teeth would look?
Oh, they would be so gross.
So if they would actually probably have fallen out. So I want you to consider that with that effect on your spine, that you have all that nerve damage and tissue damage that's been left untreated for quite some time. And you're really fortunate you're not in more pain than you already are. And the other thing I want you to kind of take a note of is, like I said, it's been an accumulation of events over your whole life. So because of that, because it took you time to get into this condition, it's going to take time to get you out of it.
Oh, jeez.
So I don't want you to be worried. We do have a plan, but I want you to think about it like if you were to lose weight. Say it takes 10 years for you to gain that weight. Can you lose it in 10 days?
Oh, no way. It'd be impossible.
Because of that, it does take time. Now, I want you to kind of put that time concept away for a second. We'll touch again on it at the end.
Okay.
So, but first, let's talk about where you are right now. Talk about those exam findings and what's the result of that untreated activity.
That'll be great.
So, I'm going to flip to this page right here. So, your spine has been pushed and pulled out of alignment. And because of that, it's become less flexible, it causes inflammation, swelling, and even pinching on the nerves that flow out from the bones, which are known as vertebra. And the medical term for that is a subluxation. Now, I do have this cool chart over here that discusses, you can see here all the nerves flowing out from different regions of the spine to different areas of the body.
Yes,
And
I can see where you're pointing.
so you can see here how our brain is kind of our command center, or the central nervous system. And because it's sending it's sending different signals and messages to the rest of the body and those organs, that is how it's able to function and to heal itself. Now, you came in here with low back pain, and you can see from our chart over here that you can see in the low back area and it shows those symptoms that it can have pain in the groin, down the leg, even cause some abdominal problems as well. Sounds like your issues, doesn't it?
It sounds just like what's happening to me.
Another example I want you to consider, think of those pinched nerves like a cell phone breaking up. I don't know if you've had it in this area, but a lot of times when we start to lose that signal and we're talking on the phone with our dear loved ones, sometimes when it starts breaking up, we don't get that whole message, or our phone drops the call. And when that happens, we have to move and try to get that whole message because it's important to us.
Right.
And it's that same thing with our central nervous system. When it can't get to that message to the rest of the body, then that's what causes that pain, and even causes some disease as well, because it's not able to heal and diagnose itself properly.
Oh.
So it's more than just neck pain or back pain. Like I said, it causes that disease as well. So what we're trying to work on is to remove that interference so that you have better health overall. And so another point on this page is we have the phases of spinal degeneration. So you can see here we have 4 stages. And I want you to think about it. Another comparison is like cancer. So if you let cancer go, let it go untreated, what happens is that it progressively gets worse, and it also affects your health. So because of that, because your spinal degeneration is similar, if we leave it alone and don't touch it, it will get worse. So right now, I would put you at a phase 2.
Okay.
And by treating it and preventing future degeneration, we can impact your health so that you don't have to worry about future issues down the road.
Okay.
All right, well, if you're all ready with that, I'm going to take you back and we're going to take a look at those x-rays so you can see what I'm talking about.
Okay, sounds good.
All right, let's go do that.